worldwide suffer from depression, and obviously the number isn't exact simply because some people don't report it or they don't have people who know. Of that, 1 million people commit suicide each year. So it's, again, not exact simply because sometimes it's not reported or it doesn't go to the news, stuff like that. So the symptoms to look for people who may or may not be depressed is if they're sleeping more or less, have difficulty concentrating, feeling of hopelessness or helplessness, overwhelming uncontrollable negative thoughts, loss of appetite or an increase in appetite. Again, it can go both ways. An increase in irritability, aggression, or anger. So if someone seems easily aggressive, like you do one little joke and they get really upset about it. An increase in alcohol consumption and or reckless behavior. So if someone starts drinking a lot or start doing drugs, stuff like that. And then thoughts that life is not worth living. Okay, so signs that someone is suicidal. So the person has been talking about being a burden or feeling trapped. Sometimes they'll actually feel physical pain, having no reason to live, or if they talk about killing themselves, even in a joking manner, it could mean that they're actually thinking it through. Behavior for people who may or may not be considering suicide is an increase in use of alcohol or drug, looking for a way to kill themselves. So if they've been searching places to get rope, or they've been stockpiling meds or stuff like that. They've been acting recklessly, so maybe they've been running across the street for no random reason or jumping off of rocks or something. If they've been withdrawing from activities, so if they've quit sports, quit any clubs they've been in, not been hanging out with friends. If they're isolating from their family and friends, so if you notice anyone that they come home and they go to the room and they don't talk to their family or don't really hang out with their friends anymore, stuff like that. If they're visiting or calling people to say goodbye, so if they're calling loved ones, be like, hey, I love you, and then they hang up or something. If they're giving away prized possessions, so if you know someone who loves an object that they have and they're giving stuff away, they may be considering suicide and want to make sure their stuff is cared for after they die. And again, if they're being extremely aggressive. Okay, so these are some moods people who are maybe suicidal. So if obviously they're depressed, if they're losing interest in things, they've been aggressive, they've been humiliated at school if they're being bullied, or if they're suffering from anxiety. So there are really two main types of depression. There's major depressive disorder, which is really just a loss of interest in the more common known of depression. And then the second kind is a more mild, where they make us be kind of mildly depressed, but it lasts a long period of time. Some treatments are medication. Some people get antidepressants or stuff for anxiety. Electroconvulsive therapy, which is similar to electroshock therapy. It's a less crude way where it kind of gives a person a seizure, which kind of relaxes certain parts of their brain so they're not as depressed, or if they're suffering from anxiety, it helps relax them. And then cognitive behavior therapy, which is a sort of therapy where they kind of change the mindset of the person. So if they're thinking about killing themselves, it kind of points them more towards what could happen if they continue to live on, things that could continue. Psychotherapies, which last about 12 to 16 weeks. It doesn't last as long term. They meet 1 to 2 times a week. It's not like you just drop in and talk to your therapist. And then last one, they work at changing negative thoughts. If you're depressed because some kids are making fun of you at school, you could change the negative thoughts to being those kids are making fun of you because they're jealous. It kind of changes the negative thoughts to a more positive form. And it's kind of used partially with people with personality disorders and people who have committed suicide in the past or are really close to committing suicide. So basically I found this quote which kind of sums up female suicides. Is women can't kill themselves because they can't stand the pain, or men kill themselves when they can't stand the shame. Men usually kill themselves because they've either failed their family, like they've lost a job and they can't feed their family very well, where women feel that they're suffering so much that they don't want to live anymore. So what drives people to kill themselves? So the mental health conditions are depression, bipolar disorder, which is where you're depressed and then you're really happy, and then you're depressed. It's like you're really depressed and then you're really happy. It's up and low points. And if a person knows they're hitting the end of their high point, they'll kill themselves before they're severely depressed because they don't want to live through that again. Schizophrenia and borderline or antisocial personality disorder, conduct disorders, psychotic disorders, or psychotic symptoms, in any context of disorders. Anxiety, someone suffering from anxiety, they may commit suicide because they're too worried about everything else that's going on. And then substance abuse disorders, if a person is drinking a lot of alcohol, if they're doing drugs, and then if they can't afford that anymore, or if they know they shouldn't be doing that, they might kill themselves, so they stop. Environmental factors, so stressful life events, a death in the family, a recent divorce, a move, a loss of a job, exposure to another person's suicide. So if you've had a friend or a loved one that's committed suicide in the past, it might actually drive you to also end your life. Or like if you have seen, if you didn't know the person but you saw them commit suicide, like if you're walking home and you see someone jump off a bridge to kill themselves, that could also drive you to end your life. So the American Foundation for Suicide Prevention raised money for research towards more treatments for people who are suffering from suicidal thoughts and depression. They also raise money to help victims of, like, the family of people who have committed suicide. They work all around the U.S. They've got events going on all the time. They do like marathons to raise money, and they've got different events they do year-round. And then from this morning, Amanda Todd, they have arrested a man who was living in the Netherlands, and Amanda Todd lived in Canada. So they never actually met in person. When the man had first contacted Amanda, she was 11 years old, and then when she killed herself, she was 15 years old. So he had actually tormented her for about 4 years before she ended her life. He's being charged with the very long list of stuff there. Any questions?